So I ask you as a physio, what happens to most of the stitches in the meniscus? They're non-dissolvable. They stay in situ for, if you had it done at 30, 40 years of age, they'll stay in situ in your knee for 60 years. It's like having a suture underneath your heel. It doesn't dissolve. People think they dissolve. They say, oh, they might cover with a bit of scar tissue, but they don't dissolve. And so and you've got all this force through there, and the stitches come loose. And when you actually look arthroscopically, the stitch is like a little piece, like a little stitch that we do the sewing. It rambles around in the knee joint. So what does it do in the knee joint? It causes chondral damage. So the femoral condyle gets grooves in it. And so, again, I'm very apprehensive when patients have had a stitch with one of those three types of tears. So, again, and we're seeing it much more regularly now, is stitches. And what ends up happening is they continue to get a bit of discomfort through the joint line, often not a lot of swelling, because chondral irritation, just the condyle, doesn't cause a lot of swelling. So there's not a great effusion. There's discomfort, inability to be able to go to the next stage of the rehab. MRI done by the surgeon, that's not going well, the patient goes back to the surgeon. I've done an MRI, really hard to interpret a meniscal repair. However, in every single case clinically when a patient has had a meniscal repair and we've tried to progress them through rehab and they're getting discomfort, every single time, and I can vouch this, Scout's honour, and I've sent them back for an arthroscope, every single time that stitch has come out, every single time. And it's causing an irritation of the chondral surface. So take home message, horizontal tears, cleavage tears, bucket handle, complex tears, don't generally do well with stitching.